Welcome to Idea Sessions. In this video, we will cover 8 facts about the effect of porn, sex, and drug addiction on mental health. Impaired cognitive functioning. Impaired cognitive functioning is a significant effect of both porn and drug addiction on mental health. Addiction to porn or drugs can disrupt normal brain function, leading to deficits in attention, memory, and decision-making skills. Individuals may find it challenging to concentrate on tasks, retain information, or make rational choices, impairing their ability to function effectively in various aspects of life. This cognitive impairment can interfere with work or academic performance, strain relationships, and contribute to feelings of frustration and low self-esteem. Moreover, continued engagement in addictive behaviors, despite negative consequences, can further exacerbate cognitive deficits, perpetuating a cycle of addiction and mental health deterioration. Addressing impaired cognitive functioning through comprehensive treatment approaches is essential for promoting recovery and restoring optimal mental well-being for individuals struggling with porn or drug addiction. Increased risk of anxiety and depression. Porn and drug addiction significantly increase the risk of anxiety and depression, profoundly affecting mental health. Individuals grappling with these addictions often experience heightened levels of stress, worry, and emotional distress. Porn addiction can lead to feelings of guilt, shame, and inadequacy, particularly if it conflicts with personal values or impacts relationships. Similarly, drug addiction can exacerbate underlying anxiety and depression, as substances may be used to self-medicate or alleviate symptoms temporarily. The cycle of addiction further compounds these mental health issues, as individuals may experience withdrawal symptoms, cravings, and difficulty regulating emotions. Left untreated, the co-occurrence of addiction and anxiety or depression can lead to a downward spiral, impacting overall quality of life and increasing the risk of suicidal ideation or self-harm. Addressing both addiction and mental health concerns concurrently through comprehensive treatment is crucial for mitigating these risks and promoting recovery. Social isolation and relationship problems. Porn and drug addiction can lead to social isolation and relationship problems, profoundly impacting mental health. Individuals struggling with these addictions may prioritize their addictive behaviors over social interactions, withdrawing from friends, family, and community activities. This isolation can exacerbate feelings of loneliness, alienation, and low self-esteem, contributing to a downward spiral of mental health deterioration. Moreover, addiction can strain relationships, as loved ones may feel neglected, betrayed, or unable to understand the extent of the addiction. Trust issues, communication breakdowns, and conflicts often arise, further deepening the sense of isolation and exacerbating mental health issues. Breaking the cycle of addiction and rebuilding relationships requires comprehensive support and intervention, addressing both the addictive behaviors and underlying emotional needs. By fostering connection, understanding, and healthy communication, individuals can begin to repair relationships and rebuild a supportive social network conducive to recovery and improved mental well-being. Financial and legal problems. Porn and drug addiction can lead to significant financial and legal problems, exacerbating mental health issues. Individuals may spend substantial amounts of money on pornography, illicit drugs, or related paraphernalia, leading to financial strain, debt, and financial instability. Moreover, addiction can impair judgment and decision-making, leading individuals to engage in risky behaviors such as theft, fraud, or illegal drug transactions, which can result in legal consequences. The stress of dealing with financial and legal problems can exacerbate underlying mental health issues, leading to heightened levels of anxiety, depression, and distress. Addressing addiction-related financial and legal issues requires comprehensive support and intervention, including financial counseling, legal assistance, and addiction treatment. By addressing these challenges holistically, individuals can begin to regain control of their lives, reduce the impact on their mental health, and work towards sustainable recovery. Physical health complications. While porn addiction typically doesn't directly cause physical health complications, it can indirectly impact physical well-being by promoting sedentary behavior and neglecting self-care. Individuals addicted to porn may spend long hours sitting in front of screens, leading to a lack of physical activity, weight gain, and related health issues such as obesity and cardiovascular problems. Moreover, excessive porn consumption may disrupt sleep patterns, leading to fatigue and impaired immune function. In contrast, drug addiction can have profound physical health implications. Substance abuse can lead to a wide range of physical health complications, including liver damage, respiratory issues, infectious diseases, cardiovascular problems, and neurological impairments. These physical health complications can exacerbate mental health issues, contributing to a vicious cycle of addiction and declining overall well-being. Addressing both the physical and mental health aspects of addiction is crucial for promoting holistic recovery and improving overall quality of life. Negative self-image and low self-esteem. Both porn and drug addiction can significantly contribute to negative self-image and low self-esteem, deeply impacting mental health. Individuals struggling with these addictions may experience feelings of guilt, shame, and worthlessness due to their inability to control their behaviors or adhere to societal norms. Porn addiction, in particular, can distort perceptions of sexuality and body image, leading to unrealistic expectations and feelings of inadequacy. Similarly, drug addiction can erode self-esteem as individuals may engage in behaviors that conflict with their values and lead to self-destructive patterns. The cycle of addiction often perpetuates negative self-talk and self-criticism, further reinforcing feelings of unworthiness and hopelessness. Addressing underlying issues of self-esteem and self-worth is essential in addiction recovery, requiring therapeutic interventions that promote self-acceptance, resilience, and a positive sense of identity. Difficulty in coping with stress. Porn and drug addiction can greatly hinder an individual's ability to cope with stress effectively, exacerbating mental health challenges. Rather than developing healthy coping mechanisms, individuals may turn to addictive behaviors as a maladaptive way to escape or numb themselves from stressors. Over time, reliance on these coping mechanisms can lead to a cycle of dependency, making it increasingly difficult to manage stress in a healthy manner. As addiction progresses, individuals may find themselves feeling overwhelmed by stress, leading to heightened levels of anxiety, irritability, and emotional instability. This difficulty in coping with stress can further perpetuate the cycle of addiction, as individuals may turn to addictive behaviors as a means of self-soothing or coping with negative emotions. Effective treatment for addiction involves learning and practicing healthy coping strategies to manage stress and build resilience. Sleep disturbances. Both porn and drug addiction can lead to sleep disturbances, which can have detrimental effects on mental health. Excessive engagement in addictive behaviors can disrupt normal sleep patterns, leading to difficulties falling asleep, staying asleep, or achieving restorative sleep. This disruption can result in fatigue, irritability, and impaired cognitive functioning during waking hours. Furthermore, sleep disturbances can exacerbate existing mental health issues, such as anxiety and depression, making it more challenging to manage symptoms effectively. In turn, the resulting mental health problems can contribute to further sleep disturbances, creating a vicious cycle that negatively impacts overall well-being. Addressing sleep disturbances as part of addiction treatment involves implementing strategies to improve sleep hygiene, manage stress, and promote relaxation. By prioritizing restorative sleep, individuals can enhance their mental health and support their recovery journey from addiction. It's important to note that the effects of addiction on mental health can vary depending on individual factors, such as the severity of addiction, co-occurring mental health disorders, and personal resilience. If you found value in today's video, make sure to watch our other videos about mental health and subscribe to our channel for more insightful content. By subscribing, it will help us do similar videos. So if you haven't already, subscribe and hit that notification bell to never miss an update. In the description below, there are links that can help you work on reducing your anxiety, stress, insomnia, and depression. Thank you for watching. See you in the next video.